Panchajanya, the divine conch of Bhagwan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There are all the efforts were done for the establishment of Dharma. Dharma was kept to our personal relations and motives. Keeping the same motive in our mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All this while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharat Rashtra, and values to all strata of people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field, hence they aim to make people aware of this and also try their best to solve this on the go. So, in order to for all of this to be achieved, we have set up various wings with working principles and objectives that help achieve the goals faster and easier in the coming years. They are Ahilyabai Wing, Swami Vivekananda Wing, Karnatabala Wing, Govardhana Wing, Ashwin's Wing, Narada Wing, Kautilya Wing, Veda Vyasa Wing, Nadanda Wing, and Sanjay Wing. All these wings has some specific functions and which they are required to perform their duties. So this lecture series is undertaking of the Wing Veda Vyasa. Today we have Dr. Kavya Mohan ma'am, BMS, MD, PhD, Assistant Professor and Pediatric Consultant, Department of Kaumarabhritya, Parallel Institute of Ayurveda, Vadodara, Gujarat. Ma'am has published 6 papers in indexed peer-reviewed international journals. To add, she has presented 11 papers in different national and international seminars. She had been the resource person for various seminars, conference, webinars. She has adjudicated about 4 research papers till date. She is also a reviewer of index journals. She has contributed the chapter Biological Effects of Ayurvedic Formulations in the book Ayurveda in the New Millennium, published by CRC Press, Taylor and Francis Group, United States. Ma'am has also authored a textbook on research methodology and medical statistics. Ma'am has received Best Teacher Award in the year 2023, sponsored by Divya Roshni Foundation, Vadodara, and Kashyap Award by NIMA. Ma'am is, as I said, currently working as assistant professor in Parallel Institute of Ayurveda, Vadodara, Gujarat. Ma'am, we are very glad to have you on the session today with us. This is our first session, so you are bearing the torchlight for the series that follows. So over to you, ma'am.
Thank you so much. Thank you for this great opportunity. Uh, I am glad to be with Panchajanya for sharing my thoughts and my knowledge with the UG students. Thank you so much, and thank you for giving me this opportunity. Shall I share my screen?
Yes, ma'am. I will add it to the stream.
Okay. Is the screen visible?
Yes, ma'am. Now it's visible.
Uh, my slides are visible, right?
Um, Slides aren't visible yet, ma'am. You have to change your screen, ma'am. It's in the web browser stage.
Okay.
You have to tap on present, ma'am.
I have done that. So now is it visible now?
No, ma'am. You have to tap on present and then whole screen, ma'am. Those are the steps.
Okay, 1 minute. Is it
Yes, ma'am. Now
visible
it's
now?
visible. Yes, ma'am. Now it's visible.
Okay.
Yes, ma'am.
So today the topic allotted for me was Aushadhi Matra. Though it is a very small topic, but it is one of the important topics in Kaumarabhritya. All the students who are learning Kaumarabhritya should be have an adequate knowledge regarding the Aushadhi Matra, because if you know the Aushadhi Matra, or if you know how to decide the Matra, then only you can treat a pediatric patient. So moving on to the topic. So these are the contents of my today's presentation. A brief introduction regarding posology. Posology according to different acharyas, dosage of ghrita, dosage of churna, dosage of kashaya, dosage of kalka, dosage of basti, modern aspects, and conclusion. Moving to introduction. So we will have a brief introduction. So you know what are pediatric patients, what is mean by pediatrics. Okay, so pediatric, as you know, they are considered as mini adults or a small form of adults, which are in growth, or in by the process of growth they will be coming to the adult stage. So till that stage they will be considered as mini adults. And also there are a lot of differences in the physiological and anatomical aspects of children and adults, because of which you should decide the dose of children very cautiously. So there is a lot of difference in absorption, distribution, metabolism, and excretion of drugs in children. So that is why the fixing of dosage or Aushadhi Matra Nirdharana is very important in pediatric patients. So this is a brief introduction. Remember that children are considered as mini adults, and there are a lot of differences in both anatomical and physiological aspects of children and adults. So coming to the first slide, that is Bala Chikitsa speciality. What is special in Bala Chikitsa? So many of you might have been known this shloka. This is from Charaka Chikitsa, 30th chapter. Dosha dushya malaschaiva mahatam vyadhayasya ye ta eva sarve balana matratu alpatara mada. This is the Chikilsa Siddhanta of Bala taken from Charaka Chikilsa Sthana. So dosha dushya malashaiva mahadam vyadayasyaye ta eva sarve balana matratu alpatara mada. The dosha, dushya, mala, vyadhi, everything are common in children and in adults. But the difference is that their intensity or the dosage of the medicines, everything should be matra to alpatara mada. It will be in a lower grade when considered to adults. So all the dosha, dushya, mala, and vyadhis are similar in both adults and children, but it differs according to their dosage. And this is explained by Charaga Chikilsasthana, 30th chapter. Pheshajam swalpa matram tu yatha vyadhi prayojayet madhurani kashayani kshiravati mruduni cha prayojayet bhishak bale matiman apramadataha. So this is a reference of Acharya Charaka given regarding the dosage of children, dosage of medicine in children. That is like the dosage, the meaning of this sloka is the dosage depends upon the vyadhi, vyadhi by which the child is affected. Bheshajam swalpa matram tu yatha vyadhi prayoje. Depending upon the disease only, you have to decide the dosage in a child. And also, madhurani kashayani kshiravati mruduni cha. The drugs should be used in the form that is having madhura and kashaya type, and also it should be mixed with kshira, because children are the all the medicines that are given to a pediatric child should be very much palatable, because palatability is a main problem that we are seeing in case of pediatric patients. So for making it palatable and for making it light, you have to mix it with kshira and mridunicha, and it should be in a mild, the virya of the medicine should be mridu. or the effect of the medicine should be mridu. Madhurani kashayani kshiravandi mriduni cha. So prayojayet bhishak bale madiman apramadataha. So a wise physician should decide the dosage according to the vyadhi of the child, and it should be in a reduced quantity. It should be mixed with kshira and made to mridu in consistency. Okay, so this is the reference given by Acharya Charaka regarding dosage of medicine in children. And other than Acharya Charaka, other acharyas like Acharya Sushruta, Acharya Kashyapa, Yoga Ratnakara, and Sharakdhara had also given different opinions. Now we will go into that. First is regarding the opinion of Acharya Kashyapa. As you know, Kashyapa Samhita, many of the chapters in Kashyapa Samhita are exclusively related with pediatric, and Kashyapa Samhita is considered as the main major grantha for pediatric. Not only regarding pediatric topics, other topics are also available, but essentially most of the topics are related to pediatric only. So, according to Acharya Kashyapa, in Kashyapa Sutrasthana 18th chapter, or the first available chapter of Kashyapa Samhita, it is mentioned that Vidanga phala matram tu jata matrasya dehinah bheshajam madhu sarpirbhyam matiman upakalpayet varthamanasya tu shishoho mase mase vivardhayet adha amalaka matram tu param vidwan na varthayet. So only Acharya Kashyapa had given the dosage of Jata Matra. No other Acharyas had given. I think you know what is the meaning of Jata Matra. Jata Matra means a newborn or a just born baby is known as Jata Matra. So only Acharya Kashyapa had explained the dosage of Jata Matra. In no other Samhitas you will get the reference of Jata Matra in dosage. So according to Acharya Kashyapa, Vidanga Phala Matra. You know what is Vidanga? The drug Vidanga you will be knowing. So the Jada Matra should be given the dosage of 1 Vidanga Phala as medicine. Okay. For Jada Matra should be given medicine in the dosage of 1 Vidanga Phala. Bheshajam madhu sarpirbhyam matiman upakalpayet. A wise physician should always mix the medicines with madhu and sarpi. In case of pediatrics, when you are giving medicine, it should be mixed with madhu and sarpi. And the dosage of Jata Matra is 1 Vidanga Phala. Vardhamanasya tu shishoho mase mase vivarthayet. When the baby is growing, it should be increased. The dosage should be increased every month. Vardhamanasya tu shishoho. Depending upon the growth of the child or depending upon the development of the child, mase mase vivarthet. The dose should be increased every month. Adha amalaka matram tu. Once the dose had reached the size of 1 amalaka, once the dose or the once you are increasing the dose and it reaches the size of 1 amalaka matra, param vidwan navarthayet. Then again the dosage should not be increased. So this is the opinion of Acharya Kashyapa. So this is regarding the explanation. According to age and physical condition, age dosage should be according to age and physical condition. Only Acharya who is explaining regarding Jata Matra, dosage of Jata Matra is Kashyapa, Acharya Kashyapa, and newborn or Jata Matra should be given medicine in the quantity of 1 Vidanga Phala, and as the child is growing, the dosage should be increased and maximum dose should be of 1 Amalaka Matra. After that, the dosage should not be increased. Then next coming to the dosage of or the opinion of Acharya Sharangdhara. बालस्य प्रथमे मासि देया भेषजरत्तिका अवलेहीकृत एकैक क्षीर क्षौद्र सिदा हृदैः वर्धये तावदेकैकां यावद्भवति वत्सरः माशैर्वृद्धिः तत् ऊर्ध्व स्यात् यावत् षोडशवत्सराः Tadaha sthira bhavet yavad varshani saptatihi. So, according to Acharya Sharangadhara, Balasya Pradhame Masi, during the first month, the child should be given medicine in the dosage of 1 ratti, Bheshaja Rattika, or the dosage of child during the first month is 1 ratti, and 1 ratti means 125 milligram. Okay. After that, Acharya is explaining that the medicine should be in the form of avaleha, or it should be in the form of a paste. Krita ekaika Kshira Kshaudra Sita Hridaihi. It should be mixed either with Kshira, Kshaudra. Kshaudra is honey, Sita, sugar, or it should be mixed with Krita. Avalehi Krita Ekaika, 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 Kshira Kshaudra Sita Hridaihi. The form of the medicine should be in the form of Avaleha, and it should be mixed either with Kshira, Kshaudra, Sita, or Krita, and the dosage is 1 rati, that is 125 mg. Next is Vardhaye Tavadekaikam Yavad Bhavati Vatsaraha. Till the child reaches the age of 1 Vatsara, that is 1 year. Okay, till the child reaches the age of Vatsara, that is 1 year, 1 rati should be increased every month. Okay, Vardhaye Tavadekaikam. One rati should be increased every month till the child reaches 1 year. Okay, so that by the age of dose increased by 1 rati in successive months up to 12 months, that is 1 year. So that by the age of 1 year, the dosage of the child will be 12 rati. Okay, then Mashair Vridhihi Tadurtham. After that, that means after 1 year of age, Mashai Vridhihi. 1 Masha should be increased every year. Tadurtham Syat Yavat Shodasha Vatsaraha. Till the child reaches the age of 16 years, 1 Masha should be increased every year. Okay, so then the dosage should be increased by 1 Masha. 1 Masha means, according to modern, it is 1 gram. Okay, 1 gram every year up to 16 years, so that by the age of 16 years, the dosage of the child will be 16 masha, that is equal to the adult dose, and this dosage should be continued till the age of 70 years. Varshani Saptatihi. So this is the opinion of Acharya Sharangdara. Once again I will tell. So when the baby is of the age of 1 month, the dosage should be 1 rati, and it should be in the form of avaleha mixed with the kshira, either with kshira, kshaudra, sita, or ghrida. After that, 1 rati should be increased every month till the child reaches the age of 1 year. That is, at 1 year of age, the total dose will be 12 rati. Afterwards, after 1 year, till the age of 16 years, 1 masha should be increased every year, so that by the age of 16 years, the dosage will be, total dose will be 16 masha. 1 masha is 1 gram. Okay, so which is equal to the adult dose, and this dose should be continued till the age of 70 years. So this is the opinion of Acharya Sharangdara. Then next, coming to the dosage of or opinion of Acharya Sushruta, Tatra Masadurthvam Kshirapaya Anguli Parvadvaya Grahana Sammitam Aushadha Matram Vidadhyat Kola Asti Sammidam Kalka Matram Kshira Annadaya Kola Sammidam Annadayeti. Okay, so this is explained in Susruta Sharirasthana. Tatra Masadurthvam Kshirapaya Anguli Parvadvaya Grahana Sammidam Aushadha Matram Vidhadyat. Kshirapa, you know that if you have learned Vayovargikarana, there is a division of the age according to what the baby is having, or according to what the baby is taking as anna, that is kshirapa, kshira annada, and annada. Kshirapa is the stage when the child is taking only milk. Kshira Annada, both milk. Milk means breast milk. Okay, breast milk and little bit of other semi-solid type of food. Annada is completely depend on solid foods. Okay, so this is Kshirapa, Kshira Annada and Annada classification. Sushruta had made classification according to Kshirapa, Kshira Annada and Annada. So even coming to Kshirapa, the dosage should be Anguli Parva Dvaya Grahana Sammitam. Means the dosage should be, when you are considering two fingers, the dose should be the dosage of the medicine should be like how much it is coming between two uh, proximal part of your fingers. Okay, or the two agrabhaga of your fingers or phalanges, how much ever medicine is coming at the agrabhaga of your phalanges should be taken as the dosage. That means you can consider it as one pinch full. Okay, this is considered as one pinch full. Okay, Anguli Parvadvaya Grahana Sammitam. Okay, Parva means end or the agrabhaga or edge of your the last part of your phalanges. Okay, so that is the dosage of Kshirapa. Coming to Kshira Annada, it is Kola Asti Sammidam. Kola Asti, Kola means Badara fruit. Okay, Kola Asti Sammidam. And when it is coming to Annada Avastha, it is Kola Sammidam, one size of one Badara fruit. The Kshira Annada is one Kola Asti. The size of one Kola Asti should be considered. And coming to Annada Avastha, it is one size of one Badara fruit or one Kola fruit. Okay, so this is the opinion of Acharya Sushruta. Next, coming to the opinion of Acharya Yoga Ratnakara. So the Acharya Yoga Ratnakara had almost same opinion. Almost, it is not almost, it is same opinion of like that of Acharya Sharandara. That's why I didn't mention the shlokas. In the table you can see same like that of Acharya Sharandara. Pradhama Masa, it is one rati mixed with either Ghrita, Madhu, Kshira or Sharkara. From next month till the age of 12 years, one rati to be increased every month, so that by the age of 1 year, total dose is 12 rati. Up to 16 years, one masha should be increased. That is from after 1 year till 16 years. One masha is to be increased every year, so that by the age of 16 years, total dose will be 16 masha. So these are the opinions of different acharyas according to different acharyas in dosage. Acharya Kashyapa, Sharadhara, Sushruta, and Yogaratnagara. Even you should mention this sloka when you are writing in your exam. That is Samanya Chikitsa. This is a small opinion regarding Acharya explained by Acharya Charaka. So these are very important, and if possible, you have to by heart any one of the sloka for your exams, for your final exams. You have to by heart any one of the slokas regarding Aushadha Matra, because one question will be there from in your final exam. One question will be there from this topic, because this topic is very important and there is no exams that has left this part. So one question will be there. So next we are going into different Aushadhi Kalpanas and their matra, like Churna, Kalka, Kashaya and their matra. Okay. So first we are going into dosage of Churna. Churna, all these references are from Kashyapa Samhita, Khilastana, third chapter, that is regarding uh, medicines only, preparation of medicines and all. So Kashyapa Samhita, Khilastana, third chapter, you will get all the references of different preparations and their dosage. If you want to go through the shlokas, just go and refer the chapter. So coming to churnas, if it is a Deepaniya churna, then the dosage should be Agra Parva Anguli Grahya. That is same like that of your Sushruda's reference, Acharya Sushruda's reference. In Kshirapa, we have told one pinch full. Same references for Deepaniya churna. The Agra Parva Anguli Grahya, the dose that can be, or the medicine that can be taken in one pinch. Okay, so that is for Deepaniya Churna. If you are taking a Jivaniya or Samshamaniya Churna, then it should be Dviguna Matra of Deepaniya Churna, or 2 times that of Deepaniya Churna. See, if you are taking 1 pinch of Deepaniya Churna, then Jivaniya and Samshamaniya Churna should be taken 2 pinches. Okay, that is Dviguna. Shodhaniya Churna. Shodhaniya Churna, of course, Shodhana means Vamana, Virechana, all those Shodhana types of Churna should be taken Ardha Matra, half that of Deepaniya Churna. That is half pinch. Okay, so 1 pinch for Deepaniya Churna, 2 pinch for Samshamaniya Churna, and half pinch for Shodhaniya Churna. Okay, so this is regarding Churna. Then dosage of Kashaya, that is from same Kashyapa Samhita Khilastana's 3rd chapter. Dosha Nashaga Kashayas. Dosha Nashaga means or Vata Pitta Kapha, separate. Dosha, all Dosha Nashaga Kashayas should be taken in the dosage of 2 prasrita. Either it should be mixed with Sharkara or Madhu. Okay, mixed with Sharkara and Madhu. And Dosha Nashaga Kashaya should be taken in the dosage of 2 prasrita. Vamaka and Virechaka or Shodhaniya Kashaya should be taken in the dosage of 1 prasrita, and 1 prasrita is 96 grams. Jivaniya and Samshamaniya Kashaya should be taken in the dosage of 2 prasrita. Okay, there is nothing much to explain from, that's why directly I have given a table. From the table only you can directly get the reference, and even there is nothing much to explain in the dosages. So just remember all these things. Dosha Nashaga Kashaya should be taken 2 prasrita. Pamaka and Virejanaka should be taken 1 prasrita. Jivaniya and Samshamaniya again in 2 prasrita. 1 prasrita is 96 grams. Next, coming to Kalka, same chapter, Kashyapa Samhita Khilastana, 3rd chapter. Deepaniya Kalka should be taken in the dosage of 1 aksha. 1 aksha is 12 grams. Jivaniya and Samshamaniya Kalka should be taken Dviguna of Deepaniya Kalka, that is 2 aksha. 2 times that of Deepaniya Kalka means if it is taken as 1 aksha, then Jivaniya and Samshamaniya should be taken in the dosage of 2 aksha. And Vamaka and Virechaka Kalka should be taken Ardha Matra of Deepaniya Kalka, that is half aksha. So Deepaniya is 1 aksha, Jivaniya and Samshamaniya 2 aksha, Vamaka and Virechaka half aksha. Okay, you should not explain it as 2 aksha, half aksha like that. You should explain it as Dviguna Matra and Artha Matra. In brackets, you can mention it as 2 aksha, because the reference is not directly like 2 aksha or Artha half aksha like that. It is in classics, it is explained as Dviguna Matra and Artha Matra. So when you are writing, write like, that's why I have put it as or 2 aksha or half aksha like that. So when you are mentioning directly, you should mention it as Dviguna of Deepaniya Kalka or Ardha Matra of Deepaniya Kalka. Okay. Next is dosage of Khrida, and only Acharya Kashyapa had given this much detail regarding the dosage of Khrida in pediatric patients. Okay, this reference is especially seen in Kashyapa Samhita only. So Jada Matra, that is from 1 to 5 days. Okay, from 1st day to 5th day, the dosage of Ghrita should be in the dose of Kola Asti Matra, in the dose of 1 Kola Asti, that is Badara Asti of Badara fruit. From 5th to 10th day, it should be little more than Kola Asti Matra. Okay, little more than, you can consider it slightly more than, okay, or little more than Kola Asti Matra, or a little more than the Jada Matra, Matra of Ghrita. From 11th to 20th days, the dosage of Ghrita is Kola Artha Matra, that is half the fruit of 1 badara. Okay, half fruit of 1 badara, half fruit of badara. First month it is Kola Matra, you can take 1 badara fruit. Okay, dosage similar to that of 1 badara fruit in first month. Second month, it should be slightly more than one badara fruit. The dosage should be slightly more than one badara fruit. Third month, it should be dvikola matra, 2 times of that of badara fruit. Okay, 2 times. That means you can two when you are taking two badara fruits, how much dose is coming? Similar to that dose should be taken as dosage during third month. Fourth month, it is shushka amalaga matra. Shushka amalaga matra means shushka is dry. How much medicine or how much dosage is similar to that of one dry fruit of amalaka should be taken as dosage for fourth month. Fifth to sixth month, it is ardra amalaga matra, means fresh fruit of amalaga. How the size of fresh fruit of amalaga should be taken during fifth and sixth month. Seventh and eighth month, it should be slightly more than ardra amalaka matra. Okay, so this is a brief not a brief, it is a detailed explanation of dosage of ghrida up to 8th month. Jada matra, that is first to 5th day, it is kolasti matra. From 5th to 10th day, it should be slightly more than kolasti matra. 11th to 20th day, kola ardha matra. First month, kola matra. Second month, slightly more than kola matra. Third month, dvikola matra. Fourth month, shushka amalaga matra. Fifth and sixth month, ardra amalaka matra. Seventh and eighth month, slightly more than ardra amalaka matra. Okay, and the dosage according to strength of agni. How you should decide the dosage according to the strength of agni. Okay, or according to agni bala. This reference also is taken from the same chapter, Kashyapa Khilastana, third chapter. Kshira Annada. If the child is in Kshira Annada avastha, the dosha predominance is Vata. Okay, so as there is predominance of Vata, Vata Pradhana state is there, then that time the Agni will be imbalanced. Okay, the Agni will be not properly functioning, or it will be not much. Sorry, the Agni will not be much imbalanced. Okay, so during Shira Annada Avastha, due to the predominance of Vada, the Agni will be more balanced or much balanced. So the dosage of Grida should be adjusted according to Agni. So if the Agni is more, okay, if the child is having more Agni, then you can increase the dosage according to the Agni Bela. So first you have to see the how the Agni Bela of the child is, or how the child is, when that you can assess by the when the baby is taking food, if the digestion is happening properly, if the child is feeling hungry, if the digestive system, whole excretion including, if the child is passing the motions regularly, all those things. By assessing all those things, you can assess the Agni Bala of the child. If the Agni Bala is more, then you can increase the dosage, or if the Agni Bala is less, then the dosage also should be very less, because if you are giving more dosage, it will again affect the Agni of the child. And in Annada Avastha, Jadaragni is much more balanced compared to Kshira Annada Avastha. So you can consider the dose of one Amalaka during Annada Avastha. Okay, so that is Kshira Annada and Annada Avastha. Dose of Kshirapa and Kshira Annada can be increased according to the Agni Bala, as I have already told the same. So this is the dosage schedule according to Agni Bela. And one more reference that has been given by Acharya Kashyapa is, before 12 years of age, the medicines, if you are giving a medicine to the child, it should not be given alone, or the medicine should not be administered alone. Okay, why? Because it can destroy. If you are regularly administering the medicine alone without mixing it with any of the kshira, kshaudra, or anything like that, then it can reduce the bela and ojas of the child. Because in children, as you know, if you know the definition of Kaumarabhritya, it is already explained that bala is in a sukumara avastha. Okay, very delicate stage, and there is dissimilarities, or there is imbalance, dissimilarities of prana, dosha, Dhadu, Bala, and Ojas. Okay, so because of this and because of the Sukumara Avastha, it can affect the child. Okay, so till the age of 12 years, all the medicines should be given mixed with the Kshira, Kshaudra, Madhu, or Sita. It should not be administered solely, or it should not be given alone. Okay, so this is also an opinion of Acharya Kashyapa. And next we are coming to the dose of Basti. Acharya Charaka had mentioned the dose of Basti in children. At the age of 1 year, the dose should be 1 pala, including all the medicines. The dose should be 1 pala. 1 pala is 48 grams. And every year, so it indirectly means that Basti should be started by the age of 1 year, because Acharya had given the dosage of Basti from 1 year only. So it indicates, indirectly it indicates that Basti should not be given before the age of 1 year, and the dosage of Basti should be 1 pala at the age of 1 year, and it should be increased 1 pala every year till the age of 12 years, so that by the age of 12 years the total Basti dosage will be 12 palas. And after that, 2 pala should be increased every year till the age of 18 years, so that by the age of 18 years the total Basti dosage becomes 24 palas, which is the adult dosage. Okay, so this is given, this reference is from Charaka Samhita. You should learn even the dosage of Basti also. So again, once again I will tell, at the age of 1 year it is 1 pala, and after 1 year of age it should be increased by 1 pala every year till the age of 12 years, so that by the age of 12 years the total dose will become 12 pala. And after 12 years till 18 years the dosage should be increased 2 palas every year, so that by the age of 18 years the total dosage is 24 palas, which is considered as the adult dose by Acharya Charaka. Okay, so all these are important: dosage of churna, dosage of kashaya, dosage of kalka, dosage of grita, dosage according to Agnibala, and dosage of Basti. Okay, so uh, uh, except the dosage of Basti, all the other Churna, Kashaya, Kalka, Grida, every reference is from Kashyapa Samhita, Khilastana, third chapter, and this is from Charaka Samhita. Okay, so this is the according to UG curriculum, only this much is needed for UGs regarding dosage in Ayurveda. And when you are coming to modern aspect, so already I have told you should consider pediatric population as mini adults. So drugs play a vital role in protecting, maintaining, and restoring the health of people if used rationally. Okay, to produce its optimal effect, the drug must be present in appropriate concentration at its site of action. Not only in appropriate concentration, even if the drug is not properly acting at the specific site, then also you will not get the result. So concentration achieved depends on, okay, or the effect that you will get depends upon amount of drug, that is dosage that you are giving, extent and rate of absorption. You should know all these things. Okay, so extent and rate of absorption. Extent and rate of absorption means how much how much medicine is getting absorbed into your tissues. Okay, even that also, getting absorbed into your tissues also depends the effect. And distribution, how the medicine is getting distributed. Binding or localization in tissues, this means that where it is actually, means the effect is actually, or the target site, whether it is reaching the target site. Biotransformation and excretion, these are the factors which will be affecting the medicine. Okay, which will be showing the results by the factors by which, when a medicine is taken by a person, all these factors depends on the sorry the effect of your medicine depends on all these factors: amount of drug, extent and rate of absorption, distribution, binding or localization in tissues, biotransformation, and excretion. Okay, and these are the points that I have already told. Children should be considered as mini adults. Because why it is, because why you need to focus on dosage is because up to the age of 12 years the organ development is continuous. Okay, organ development is happening till the age of 12 years. Variation in body composition and maturity of liver, kidney, and other organ functions are potential sources of differences with respect to age. So body composition, maturity of liver and kidney, and other organs are all the factors that that is showing the variation between a child and an adult. Okay, so the third point in this slide is very important, that is amount of drug, extent and rate of absorption. These are the factors that depends that affects the effect of the medicine. Okay, and next, coming to calculation of dosage. And in children, one important thing is the drug dosage should be decided according to the body weight or surface area. Okay, body weight or surface area should be the criteria for defining the dose of a child, because even if surface area is more appropriate, surface area is considered more appropriate because it is proportional to the metabolic rate of the child. Okay, so but for the convenience we are not considering the surface area, instead we are using the body weight. Okay, so these are the pediatric changes in route of administration, different route of administration, and how each pediatric age group pediatric age group is responding to the parameters, or responding to the route of administration. See, oral when you are giving a medicine as oral route, or oral oral medicine is given, neonates will be responding less compared to infants and children. Okay, in infants most of the medicines, or in children most of the medicines should be given through oral route. Infants are having less absorption power through oral route. When you are considering an IM or intramuscular medicines, it is variable in neonates, absorption is increased in infants, and in children it is almost the same absorption rate of adults. Percutaneous absorption is increased in neonates, infants also it is increased, and children it is almost near to the adult pattern. Rectal absorption is very efficient when you are considering neonates. Infants also it is efficient, and children it is almost near to that of adult pattern. Just for your understanding, I have kept this slide. No need to by heart this, or no need to write this in your exam. Just for your understanding, I have kept this table. And these are some of the factors that should be considered when you are selecting the dose. Already I have told age, weight of the body, the dosage form, route of administration, pharmacokinetics, and interaction. This is the important slide when you are considering the modern. Okay, when you are coming to modern, this slide is very important. There are three main formulas for calculating the dosage. First one is Young's formula, Freed's formula, and Clark's rule. Okay, Young's formula is usually for children over 1 year of age up to 12 years. Okay, from 1 year to 12 years, you can use Young's formula, that is dose is equal to adult dose into age of the child in years divided by age of the child in years plus 12. Okay, don't get confused here, it is age of the child in years. Okay, in Young's formula, adult dose into age of the child in years divided by age in years plus 12. Okay, Freed's formula, it is for the babies under the age of 1 year, or the pediatric population who are under the age of 1 year. You can use Freed's formula, that is dose is equal to adult dose into age of the child in months by 150. Okay, adult dose into age of the child in months. Here in Freed's formula, it is months. Age of the child in months by 150. And in Clark's rule is applicable for all the age group. That is, dose is equal to adult dose into weight of the child in lbs. It is not in kg, it is in lbs, weight of the child in lbs by 150. Okay, so these are the three major formulas, or these are the three major things you should write in your exam when Aushadhi Matra is asked. Okay, major three things that you should mention when Aushadhi Matra is asked as an essay question. You have to mention this. Okay, Young's formula for children from 1 to 12 years of age, adult dose into age of the child in years by age of the child in years plus 12. Freed's formula for children below 1 year of age, adult dose into age of the child in months by 150, and Clark's rule for all age groups, adult dose into weight of the child in lbs by 150. Okay, and other things to remember include, when you are considering an obese child, you should not decide the dose of the child according to the body weight, because in an obese, if the child is obese, the body weight will be more. Okay, so you should not decide according to the body weight of that particular child. Okay, because they will be having a slow metabolic. Anyway, it is in a the baby is in a pediatric age group, so there will be metabolic rate will be less, and the drug clearance will be reduced. So what you should do is, if you are getting an obese child, you should be calculating the dose depending upon the ideal body weight for their age. Okay, you will get the ideal weight in the weight chart. Okay, so according to the ideal body weight of the age, you should give the dosage. You should not give the dose according to the body weight of the particular obese child. Instead, you should consider the normal weight of the child at that age, and then you have to decide the dose, because the metabolic, even though the weight is more, the metabolic rate will be less, and also the drug clearance will be less for a pediatric patient. So instead of considering the body weight in a obese patient, the body weight or the normal weight of the child at that age should be taken. Okay, so pediatric patient usually require, when you are comparing a pediatric patient with an adult patient, the difference is that pediatric patient requires a higher dosage. Okay, per unit body weight, a little bit higher dose is required because their metabolic rate is higher. Okay, metabolic rate is higher, so that's why you require higher dosage compared to that of adults in pediatric. Compared to adults, you require more dose. Okay, because their metabolic rate is more. Coming to conclusion, I have included one sloka which is very catching, that is Aushadam chapi duryuktam Tikshnam sampadyade visham, visham cha vidhina yuktam bhaishajyopakalpayet. That means, if even though if you are using a medicine or a aushadha in a duryukta means, if you are using a, even if it is an aushadha, if you are not using it properly, it can become a tikshna visha. And if visha Visham cha vidhina yuktam. If it is a visha also, and if you are using it very properly, or if you are using it in a very proper manner, even it can become yuktam bhaishajyoba kalpa. It can act like a medicine. Okay, aushadam cha duryuktam. If you are improperly using a medicine, it can become a tikshna visha, and if you are using a visha properly, then it can turn into a medicine. Okay, so that is regarding today's topic. And as I have told, the important part when you are considering your exam, the important part is opinions of different acharyas: Acharya Charaka, Kashyapa, Sharangdara, Sushruta, Yogaratnagara. Yogaratnagara's opinion is same like that of Sharangdara's opinion, but at least try to remember any one sloka regarding drug dosage, because that will be adding weightage to your answers. So at least try to remember any one of the slokas. If you are not able to by heart one sloka, then you should write the explanation of different of all the acharyas, because even if it is asked as an essay question, all the opinions should be mentioned separately. If a particular if they are asking according to Kashyapa, according to Acharya Kashyapa only, you can mention only Acharya Kashyapas. Otherwise, if it is asked as a 5 mark question, or if it is asked as a 10 mark question, all the different opinions should be mentioned separately. Then the next thing is different Aushadhi Kalpanas and their dosages should be mentioned. Then a brief introduction regarding modern aspect. And this slide is very important. Okay, calculating the dosage according to pediatric. Then the factors to be considered while selecting the dosage. This slide and this slide are important. Okay, so today topic was Aushadha. If you have any doubts is there, topic is over. Shall I stop sharing my screen?
Yes, ma'am. Yes, ma'am. You can stop sharing the screen, ma'am.
Okay.
Ma'am. Uh, Thank you for your time, ma'am. It was really great session and insightful knowledge. And this was our first program since we started this organization. Previously, we were part of another organization, and now we started our own organization. And this is our first program, Pragnavaridi series, and you are the first lecturer, ma'am. So it was really a great start, and we really look forward to learn more from you and take your guidance in for our next activities in future also. And we look forward to collaborate with you and learn so many things and work for us other programs to promote Bharatiya culture and Ayurveda, ma'am. And it was really an humble opportunity for me also to host you, ma'am. It was such an honor for me also to host such an eminent lecture like you. Really, thanks
Even
for
I
accepting me.
should thank you, because as I was not knowing that this is the first lecture, but thank you for giving me that opportunity to start with my lecture. So if actually this session will be recorded and it will be sent to the students, right?
Yes, ma'am. It will be on YouTube, ma'am. And I will be
Okay,
sharing the
okay.
link of the same to you also, ma'am.
Okay, so if there is any, it means if you are getting any personal questions regarding the session, you can forward me the questions and I can share the answers to you so that you can share it to the students.
Sure, ma'am. Really, sure, ma'am. Thanks, ma'am. That's so generous of you too, ma'am. And really, thanks for accepting our invitation to take a lecture in your busy schedule, ma'am.
No problem, no problem. It was my honor to have a session, that too first session.
Yeah.
Thank you so much, Panchajanya. Thank you so much for giving me this opportunity. So I think 2 more lectures are there. I will do my level best, because even students should be getting good knowledge from my session. So
Yes,
as
ma'am.
much as possible, I will be putting my effort into this. So thank you for the giving me this opportunity. And even in future also, I am expecting to work with you. Thank you so much.
Thank you, ma'am. Thank you, ma'am. That's really very generous of you, ma'am. Thank you. Thank you so much, ma'am.
Thank you so much.
Shall we end the session, ma'am?
Yes, 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 definitely.
Thank you, ma'am. I'll be ending
Okay,
the broadcast. Thank you,
okay,
few viewers, for watching the session and being staying for us for 1 hour. If you have any doubts, you can put us. You can post the same in our WhatsApp group, and we will be forwarding that to ma'am. Thank you all.